And the last presentation of the day, and University of Florida, we're now 10 minutes over the allotted time that we had set for this. Procedurally, do we need to do anything or just keep going, correct?
Governor Martin, you keep going.
Okay, thank you.
Thank you. And we believe our presentation will be a bit briefer than the other two. But I do want to start with a commercial announcement. The Dean of Dentistry informs me that we could probably do 4 implants for $30,000. So, Governor Stavros, next time you need implants, call us.
University of Florida.
We appreciate the difficulty and the seriousness of the board's considerations in the matter of dental programs, and that you have to take into account many fiscal, economic, and strategic factors to consider in evaluating these dental proposals. You have just listened to 2 proposals from FAMU and UCF to create new dental schools. We would like to talk about one rational alternative model, which would be to expand the existing UF dental program. We believe that this would leverage the existing infrastructure and curriculum, which is longstanding, its reputation as one of the nation's leading dental schools in both education and research, and its existing network of clinics which are already operating in service to the state. And so, having said that, it's my great pleasure to introduce our Dean of the College of Dentistry, Terry Dolan, who will speak to you about specifics.
Glass of wine, cheese, and crackers.
That's what I need.
Thank you, Provost Glover. Board, thank you for entertaining, and one more, perhaps maybe not the final, but one additional presentation about dental education. I want to compliment all of you for your patience in listening and for your thoughtful review of all these potential opportunities. And also keep in mind what I'll be presenting, it's more or less an apples and orange conversation, because the 2 prior proposals were about vision and about starting something new dental schools. What I'll be speaking about is enlarging or expanding an existing successful dental school. And I'll also be presenting some of the realities as the dean of a dental school, someone who's been involved in dental education for more than 20 years, operating a school that's been around for more than 40 years, some of the practical, pragmatic issues that come into play as you make your important determinations. So our proposal is called Enhancing the Size and Diversity of the Dental Workforce through Expansion of DMD Enrollment. I will try to make my presentation as concise and brief as possible, and it will have 3 components. The first, I'll briefly describe the key elements, expected outcomes, and the budget associated with this legislative budget request. Second, I'd like to provide some general comments about why the approach we selected was the selection among many considerations. And finally, to suggest other potential approaches to expanding dental education in Florida in a cost-effective manner through partnerships and collaboration. And it sounds like some of you have already been considering those things. So to begin, these are the fundamental elements of our proposal. The University of Florida would like to expand its enrollment of its Doctor of Dental Medicine, or DMD, program. We currently enroll between 80 and 83 students per class with a total enrollment of 331. We rounded our numbers up to make the chart look better, but essentially we would like to phase in an enrollment increase over 5 years so that we would have graduating class size of 100, or a total enrollment of 400 students. The expected outcomes of this proposal and the benefits to Florida are several. One, the obvious one, is expanded dental education opportunities for Floridians. The second is our proposal to increase the diversity of the DMD student body through expanded outreach and recruitment efforts, and I'd add through collaborations, and I think there is a lot of opportunity to collaborate with FAMU and other undergraduate programs to increase the pipeline for minority and disadvantaged students into the profession of dentistry. Of course, we'd like to expand our research programs. We are one of the leading dental research institutions in this country, and through expanded enrollment, we would expand our faculty and thus hopefully expand our research program as well. Likewise, you've heard many stories where in order to educate dentists, you have to provide patient care, and so another benefit of this proposal is expanded patient care services, and of course economic development. And I won't go through the long paragraph about the economic benefits of the University of Florida, not just to the Alachua County area, but to the state of Florida. but there is a nice description of that in the proposal, and I know you've taken time to review that. Essentially, what we are requesting funding for is for facility renovation and purchase of equipment, support for expanded outreach efforts and collaboration to increase the diversity of our student body, and operating funds to support the recruitment of additional faculty and staff needed to support the program. This is the form you're familiar with, not in the exact format, but it's for slide purposes. This is the operating budget form, and it outlines recurring and non-recurring requests for year one only. What you see in this proposal is funds for diversity outreach to support the exploration of expanded academic partnerships, such as with FAMU and other SUS schools, and additional outreach efforts to recruit and retain underrepresented minority and disadvantaged students, with an estimated cost of this program at $200,000 annually. The non-recurring component is for facility expansion and renovation. We have a dental simulation laboratory, and that's critical to the education of dental students. We did receive a federal grant last year that allowed us to expand our simulation workstations from 84 to 94 stations, and that would allow us to increase our enrollment in year one by 10 students. However, to increase to a class size of 100, we'd have to do additional expansion, and so that would be done in year one in this proposal. Also, our original simulation units were purchased in 1995, and so we have to upgrade those a bit. And our estimate for the simulation renovation is $950,000. In addition, we would need to renovate a classroom at an approximate cost of $800,000 and a clinic at $1.4. So the total cost for the non-recurring year one expenditures is $3.15 million. Now the next slide is a lot busier and is actually a summary of what's in your handout on page 6, or also what was included in the LBR. All those numbers don't fit easily onto a slide, but I'll try to briefly review those, and then additional detail is in the written handout. So this slide includes our baseline, or our current operating budget, and then projects a 5-year budget to support the incremental increase for the DMD enrollment. And for example, in year one, we add the 10 additional students, 2 additional faculty, 1 support staff. We complete our building renovations, and so the total recurring and non-recurring cost for that component is $3.973 million. Moving on to year 2, we add a total of 30 additional students, 3 faculty, and 5 staff. In this model, we propose no additional renovations at an estimated cost of a little over $2 million. Operating costs increase incrementally with the increase in DMD enrollment, so that by year 5, we would need recurring support of a little over $5 million to operate with a class size of 100 students, or the 400 total DMD. So I'll give you a second to digest that, and I know you've seen this previously. So now I'd like to change gears a minute and move on to the second segment of my presentation, but of course be happy to answer questions about this proposed budget at the end of my presentation. So at this point, you might be asking yourself, why did UF submit this particular relatively modest class size expansion proposal, and did we consider other alternatives, such as regional partnerships, placing clinical education sites in underserved communities outside of Alachua County? And so the answer is yes. We considered many options prior to submitting this proposal. And yes, I would agree that other possibilities and collaborative opportunities do exist and should be fully explored before approving any proposal. You've seen this slide before, and I just wanted to reiterate that the UF College of Dentistry, through our statewide network for community oral health, does an excellent job improving access to dental care for Florida's residents. We've not been able to solve the entire challenge, but with appropriate funding, we would be willing to expand this network of satellite clinical facilities and collaborate with other academic institutions, philanthropies, community health centers, and public health units to increase the number of patients served by these programs. And I'll just use one of these clinics as an example. I was in Naples yesterday afternoon. We have our NCEF Pediatric Dental Center there. That is a public-private partnership. It is in partnership with the Community Health Center. It did leverage both state matching dollars and philanthropy, a gift of $5.5 million. And that clinic is very successful. I would also say that it was quite a challenge to get that up and running. We began our conversations about that one particular clinic in 2005, and we don't project it'll be break even until 2012. And so it takes quite a lot of time, attention, management, expertise, leverage to get these individual clinics up and running, and yet when they're done well, they can be an excellent model for community-based dental education done in partnership with community health centers, much as what was proposed by FAMU. You might also ask why we didn't propose a class size using market rate tuition, or the statement that it doesn't cost the state anything, rather than the proposal we submitted that requests state support for the additional DMD headcount. And I would suggest two main reasons for using the proposed approach. One is concern about the indebtedness of our graduates, and then the impact of the increasing cost of dental education on the state and national applicant pools. I also thought it would be useful to re-show this slide, which you saw previously during my June presentation, because I think it nicely illustrates the fluctuations in the number of applicants to dental school. So you'll see through this slide that applications reached a historical peak in 1975. During the economic downturn in the late 80s and early 90s, the number of applications to dental schools dropped dramatically to a point where there were about 1.3 applicants nationally for each available dental position. And I'd say applicants, and I didn't say qualified applicants, because that's a really important question and something that's hard to measure. But my guess is that among those applicants, perhaps not everyone was as highly qualified as the students we have the privilege of teaching today. During stronger economic times in 2006 and 2007, there were about 2.4 applicants for every available dental position. And what we see nationally is the applicant pool is flattening, and also the number of first-year seats is increasing due to the large number of private dental schools that are opening across the country, including in Florida with the LECOM dental school opening next year. So, applications to dental school are cyclical, and they're related to the economic attractiveness of dentistry as a career and to the perceived rate of return on investment for dental education. You've seen this slide before as well, but I have to emphasize the importance of student debt and how that impacts our students and graduates, their career choices, and frankly their ability, just based on economic forces, to serve underserved populations. If you attend a high-cost program, your career options are somewhat limited if you have financed that education, and I think that's a very important consideration. So yes, you could use a market rate for dental education, but the typical student could accumulate as much as $300,000 or $400,000 in student loans for their DMD degree, not including any undergraduate debt. And this debt is a tremendous burden on any new practitioner and clearly limits career choices away from primary care and public health dentistry, as students are under great economic pressure to maximize their earning power to repay their loans. So how do we justify the University of Florida proposal? The proposed expansion of the DMD class size and related dental science building renovation is justified based on 4 key concepts, and I'll describe each of them briefly. The first, and to me the most obvious, is the quality of the existing DMD program at the University of Florida. We enrolled our charter class in 1972, and the college has developed into a dental school that is nationally recognized for the quality of its academic programs, scholarship and research funding, clinical care, including community outreach and service learning. The College of Dentistry is one of a handful of dental schools in the country located on the main campus of a major research university that includes an academic health center and a teaching hospital. And this is one of the major strengths of our college. And as the dean of the State University System's only publicly supported dental school, I have to ask, would supporting one or more proposals for new dental schools disadvantage the University of Florida's program? As the stewards of the existing investments in the SUS, I would urge you to ensure that the one existing SUS dental school is adequately supported to sustain the excellence of its program before considering proposals for new dental schools. I was very interested to sit in on part of your PICO conversation because you've heard me say that our dental science building is almost 40 years old, and it could be the poster child for your PICO debate or discussion because we have an aging physical plant and we have infrastructure problems that we've done the best to maintain but still need attention and renovation. However, I would say despite our aging physical plant, we have an outstanding faculty, excellent students, a robust research program ranked 5th of all dental schools in the United States, extensive community outreach and clinical programs that help improve access to care. And I could go on and on about the quality of our academic program, but I will move on in the interest of time and move on to the second point, which I also think is very important, which has to do with the economies of scale related to the expansion of an existing program. Given the increasing cost of dental education and the skyrocketing educational debt of many graduates, it makes sense to consider potential efficiencies inherent in an existing and successful academic program rather than opening new schools. Based on our experience at UF, it takes a dental school 10 to 15 years or longer to develop a strong extramurally funded research program, and at least 5 or maybe even more 10 years to establish successful community-based clinical operations that are financially viable. So the next point relates to the question, does Florida need more dentists? And I would argue that there's probably a need for a modestly expanded, well-prepared, ethnically diverse dentist workforce in this state. You've heard lots of statistics about the adequacy of our workforce, and I would say that I think our problem is not having enough dentists. It's where they choose to practice and the economics of dental care delivery. I'll also say that there's been a study by Guthrick, Velikovic, and Brown published in 2009 that assessed the impact of approximately 10 new dental schools at that time, and there's been more subsequently, on the workforce issue. And the report concluded that these new schools would likely result in an increase in the dentist to population ratio, which you argue would be good. However, the increase in the number of dentists would not noticeably improve access to care for low-income populations and rural populations, absent additional public funding to support demand for these programs, and they're referring in that point to other things like expanding the safety net or the loan repayment programs that we know to be effective. And I would also want to reference the Department of Health report and Dr. Lamont's white paper on dental education that reached a similar conclusion, and also the Senate report that was on your agenda for today's meeting. So in conclusion, as a board, you have the opportunity to consider 3 proposals, each using a different strategy to expand dental education in Florida. I would imagine that during your reflection on these proposals, you've asked yourself some pretty important and critical questions, such as, do we need additional dental education opportunities in Florida? And if so, for what purpose? Or what problem or problems are we trying to solve through the implementation of one or more of these proposals? Are we trying to expand dental education opportunities for qualified Floridians? Are we trying to ensure adequate dentist workforce for the state of Florida? Are we trying to improve access to care for underserved Floridians? Are we trying to stimulate the economy and create jobs? And probably most importantly, what is the state university system's roles and responsibilities in addressing these critical public policy issues? And is building or expanding dental schools the most cost-effective way to accomplish one or more of these goals? The University of Florida is open to further discussion about opportunities for collaboration with other SUS institutions to ensure that our limited public resources are strategically invested, resulting in the best possible outcomes for our students, our patients, the public, and the profession of dentistry. I thank you for your time and attention and thoughtful consideration, and I certainly look forward to any questions you might have about our proposal.
Thank you very much, and we'll lead off with Governor Temple.
Yeah, just a quick one. The new expansion would, in your proposal, would come out of PICO money, I assume, right?
Well, there would be the two components. The non-recurring would be
PICO
hopefully out of PICO,
Thanks.
or it could be direct appropriations.
Okay.
Governor Beard.
How many of your students are from out of state? What percentage?
Less than 10%, and of course, you know, we respect the fact that our educational process is subsidized, and so it's unofficial policy of the college that we reserve the vast majority of seats for Florida residents.
Thank you.
Governor Parker.
On the slide that you had with your budget and the dollars, it showed, I thought I recall reading some time ago about some grant that had been awarded or some dollars you had raised in support of this proposal. Is that up there someplace? I just missed it.
Well, I mean, there is a line item, and it's easier to see on the paper handout than here. So, for example, we do have fundraising efforts, and annually we raise between $800 and $2 million a year. We also received $7.5 million from HRSA for various grants to the college, one of which paid for the first expansion of the simulation laboratory. So, you know, we do actively apply for grants and gifts, and they would be folded into the operating budget of the college. So there's not a particular line item on this budget for that.
So I was mistaken about, I guess for some reason I thought I read something that was specifically awarded to you guys to kind of deal with the issues that you were going to address with your expansion.
No, we did not use that
Didn't have
approach.
that? Okay, I
No.
must be mistaken.
Governor Tripp.
So what you've got, in a sense, is an antiquated building.
Yes, we do.
Is that fair?
That's fair.
But you've got a superb program, and it's up and running, and you know all your costs and expenses, and you have a good reputation. So why would you not want to try and partner with UCF to go into a new building where in the medical plaza down there, wouldn't that be the best move for you at the end of the day?
Well, as I've mentioned a few times in my presentation, the University of Florida, and me personally, I'm interested in exploring those potential collaborations.
Okay. So are the talks real?
We
And
have not.
Are they ongoing? It's a little frustrating for me to hear 3 presentations, and I've been on this board 3 or 4 years now, and I think we have preached partnership and collaboration, yet it seems to be coming from us and not from the players. So is it for real? And do you expect that you can have serious talks so that the taxpayers and the people in the state of Florida can get the best of both? They talk sort of like, well, if the building, you know, if we don't pay for it, the building goes back to them. They've got a building there. So what if they sell that building to Mickey Mouse? And now they've got a building sitting right in the middle of a medical plaza that they can't control anymore, and they put in, you know, this kind of a restaurant, maybe a nightclub, maybe who knows what. You can't really say, once they're committed to bringing that person into the medical facility, it's their partner, whether they like it or not. So, you know, so the issue is, and I don't think they'll fail. I'm not even talking about that. They'll make it work. There's no question about it. if they got enough problem, I think they would go to the community and they would raise enough money to make it work. So that's not my issue. But my real issue is an opportunity here to bring two wonderful universities together and have them partner so that they both get the best of both worlds.
So is your question for me or for President Hitt?
I guess I'm trying to, I guess what I'm trying to say is, would you be excited to do that? Or are the egos so big that we can't join a couple of names together and make it work? Now, you probably don't have to answer that, but, you know.
Governor Parker?
I guess my thoughts, Norm, is that if you look at the proposal that we've seen from University of Florida, I'm sorry, what's my responding? It seems like their goals and the things that they're looking to do are more in line with FAMU's proposal than with UCS proposal. So I would hate to think that if we're preaching collaboration and cooperation, that we're just pushing a UF-UCF model, and I'm not trying to push FAMU or UCF or UF into any box. But I guess I don't want there to be some assumption that, I mean, if I heard correctly from the consultant from FAMU, he also suggested there have been some conversations with UF as well. So I would hope that if we're going to preach or encourage collaboration, that we look at the benefits of all three of the proposals and suggest that they all do something together versus pushing any two or three together.
Just to answer that, I thought that FAMU already said they're in conversations with FSU because FSU's medical school is doing exactly what FAMU is trying to do, and that is to be out there in the community. So I'm trying to drive them all together to say, look, guys, we've got no money, you got great ideas, and we have opportunities. You know, can't you figure out a way to partner? And we just happen to be talking about UCF and University of Florida. They're only a couple hours away. University of Florida is already there in the medical thing. That's all I'm going. I'm not picking any partners.
Governor Duncan?
No,
President Amos,
I
would you want to
was
respond?
going to add that we have spoken with both the University of Florida and Florida State University.
And I know we're very late, so I just, and again, I've spent a lot of time talking with UF about their proposal as well. And one question that we had talked about, facility aside, which I do understand the gravity of that issue, does it make any sense, and I know you went through the whole debt thing, which I'm sure somewhat is in relation to the question I'm about to ask you of, could you take on some more students by charging a little more tuition than you're charging without having to get additional state operating funds?
Yeah, I mean, that's certainly one of the options we considered, and, it's been done on our campus, and we could have part of the class on market rate tuition and part on subsidized tuition. Frankly, I'd prefer not to do that, and part of it is my bias as someone who was educated through a state university system and know the benefits of that subsidy and has personally allowed me to pursue careers in academics and dental public health that probably wouldn't have been possible otherwise. I have a strong conviction to the importance of a state subsidy for higher education and professional education. Having said that, if we had no alternative and there was clearly a dire need for more dentists, we would use perhaps other methods to fund their education. I'd also comment that as a dentist, I think it's just as it's important to subsidize dental education. I don't know why we would choose to subsidize one profession and not another. And so I think that's a policy question that would face the Board of Governors.
Governor Husseini?
I have a question. When you you give them dental education, where do they get how do they become orthodontists? Do they go somewhere else to become orthodontists, or you can do it at the University of Florida?
No, that's an excellent question, and that reflects probably the size of our operating budget, because we get about $20 million in state support, and we leverage that into a $60 million operating budget. How do we do that? Well, we do more than teach dental students. We have all but one of the recognized specialties in dentistry residency programs. We partner with our hospital, Shands Hospital. We receive graduate medical education support to run those programs. And we have these specialty training programs, which I would agree are an important component of a fully developed dental school. Now, it's logical to start with the DMD program and grow from there, and that's what the University of Florida has done over the years. But at this point in our history, we have a full complement, minus one, which we're working on in radiology for all the recognized specialties in dentistry.
So that brings me into the next question. Governor Stavros said, you know, he spent $40,000, but you have a new deal, you can go for 30. But it's nothing new. I mean, you take your kids to orthodontists, and they're very busy. My mother just spent $100,000, you know, in dental work.
Wow. We have a faculty practice at the University.
You do. And she's 84 years old. So,
wow.
But what I'm trying to say is that it seems to
Trying to
they're
spend
very
your
busy.
inheritance. Or she's trying to spend your inheritance.
You spend $100,000. So it seems to be, Doctor, there is plenty of business out there to be had. I mean, when you call to make an appointment for a dental visit, you know, I mean, it's 3 weeks down the road. I get this thing that, you know, we have just too many dentists out there. I sure don't see it on a day-to-day that it's going. I mean, maybe you can enlighten us. You know, maybe on a specialty area, it's not enough of them. Can you enlighten us on that?
Well, the question about do we have enough dentists is a complex one. But what I would say in general is we have a serious maldistribution of dental personnel in the state of Florida and across our country. So because of market forces, most dentists choose to practice in urban environments. And I would say if you are, you know, have means and you need dental care and you live in an urban environment, you could go through the yellow pages and get excellent dental care from any number of outstanding dentists. If you are indigent and you live in a rural community or in an urban underserved community, that's a whole different story. And so it's not just do we have enough, but where do they practice, how do they practice, in what settings, do we have public support to subsidize care for those who can't pay themselves? Is there a safety net collection of clinics that make dental care accessible in underserved communities? It's much more complex than just a numbers game.
You know, that takes about a month to discuss it.
Yeah.
Thank you.
Any other questions? Okay, that ends. Thank you very much for your presentation. And that ends the three presentations that we had outlined for today's meeting. In order for us to continue this discussion, I'm going to propose a couple of things. One, I think that the original concept was to hear the presentations today. It was an informational meeting. However, I think that based upon the comments that I have heard around the table, there are a number of issues and concerns in terms of the presentations. It may have begged some additional questions that we might need to have addressed. But I think more importantly, we need to assess during this current economic time, is it appropriate for us to identify and approve two new programs and an expansion of an existing program at this particular time? I think that's the burning question that we all have to kind of get our arms around. And the question is, how do we do that? Do we say, although this was initially an informational meeting, that we need to take time and then have additional collaboration and discussion? Or do we say that we have enough information, we've heard enough, and we need to vote up or down the proposals and then decide whether or not it will be a recommendation of this committee, and that committee would then make that decision, and then does that committee recommendation then go to the full board? Or do we say, based on the lack of perceived collaboration from the universities, in that a better proposal may have been coming to us with maybe one, relying on Governor Tripp's comments earlier in terms of we have been preaching collaboration and partnerships. Although FAMU has been talking to the Florida State University, I think also to University of Florida. Correct. You have University of Central Florida reaching out to the University of Florida. It may be a conversation of the four coming together and identifying, if you have a building that's 40 years old at the University of Florida, we have money that's been identified potentially from a donor for a facility. Does it mean that the four could come together and craft some type of joint proposal, if you will? To my members of the Strategic Planning Committee, what is your desire in terms of logical next steps based on what you've heard today? What is your desire? So I'm throwing that out to the committee members and to the board. Governor Perez.
My desire is to see what the universities come back with. We spent an afternoon with them. This was a first-time proposal issue. They've heard our comments. They've heard our questions. They're very smart, professional individuals, and they're going to figure out what to come back with, rework their plans, or they think they need to get it reworked. I think it would be incredibly premature at this point to say we don't want to go forward, we might want to go forward. This was their presentation meeting to get initial feedback from us. We've given it to them. I say go back and you decide what you're going to come back with. But it would be inconceivable to me to stop a dialogue now when what we told them was this is your first meeting for presentations. There's not going to be action taken. Get our feedback and come back. I've not been briefed by a couple of these universities individually. I know when it comes down to the point of working it to the end of the process after these feedback sessions, they're going to be briefing us individually. We can ask more questions. We've had 4 hours to look at 3 monstrous proposals. We haven't given it just time, at least I haven't given it just time today or individually to even make that decision.
I second
in
that
macro
motion.
setting.
Mr. Chairman.
Governor Tim.
Yeah, I'm not on the committee, so I can't I can't do this, but I would really like to sleep on this, and I'd like to talk about it at the full board meeting tomorrow. I think I want to remind everybody that we're burning cash with all the money we're spending and the studies and the consultants and all that kind of thing, while our roofs are leaking and our roads aren't being put together. So rather than table it at this committee as a full board member, I'd rather talk about it tomorrow and see what we want to do.
Okay. Governor Root?
I would say that I don't think we have enough information. We just were introduced to this, but I think a couple concerns have come up. One is financial resources are very scarce, and I'm still not 100% sure what obligations we would have to fund these. Florida was a little clearer than the others. And also what was brought up and how these other 2 new proposals could possibly impact our state-supported program is one that we need to think about. So I think that each of us on the committee needed to spend some time better understanding each of these and then go from there.
Governor Hussaini.
I totally agree. I agree that we need our committee, table this until next time. I think we ought to give them the opportunity to come back to this committee at the next board meeting next time in November and let them work this. They have been at this for a year. So for us to cut them off right now, let them give an opportunity. Let them come back and at the next board meeting or at the next committee meeting that we have in November, let them present. Maybe they come up with the idea that make us happy. Who knows?
I like everything except a time certain. I would like to spend time with each university, and then I think it's the chairman's prerogative on when he brings it back up.
Governor Parker.
And I guess a couple things. One, I do like a time certain, if you guys can think about it. And again, I'm not on your committee either. And the reason I ask that is kind of based upon what John said. You know, these universities are spending a great deal of money preparing proposals and getting things together to present to us. And if we don't have a time certain, then that continues. And I think it's a good idea to find a way to ensure that we put a stop to that if the thinking of the board is different from the thinking of the universities. So I like the idea of a time certain, and I think that you know, I see this as universities who are making a request to the Board of Governors for, you know, a degree program. And I know we're giving it special attention because they're dental programs, but it's just another request for a degree program.
Exactly.
I think it's important that we encourage collaboration, but I also think it's important that we encourage that an end to it. Either we support it or we don't, and then we can move forward. And you know, as opposed to kind of allowing it to continue if the universities are moving in a different direction from what the board would like them to move. That's all mine.
Governor Perez.
A couple thoughts. First, if we're going to do a time certain, I'm fine with that too. We'd have to determine, have the chairman determine with the universities if November would be the reasonable time certain. But if we want to say December or whatever, I'm fine with that. I do have to. One thing was said that was interesting to me, which was we have to assess whether or not it's going to impact the other universities. If that becomes the threshold of approving other degrees, it's going to be a very interesting process. Any market rate tuition that comes in, if we say, well, this university can't do that that web-based marketing degree or MBA because it might impact another university's degree, I think that's what competition is for. So I think we need to be very careful if we go down that path. I think that's a very dangerous path. But I just again think that we should say they are very smart, very capable professionals who can figure out what they saw today and decide if they want to come back and how they want to come back. And it would stun me if we cut that conversation short. As to the money they're spending, that is their decision to make. They've got donors. They've got.
Really?
Yeah. I mean, this is.
I don't think so.
Governor Tripp.
The one thing that has not been presented satisfactorily, I believe, to your committee is whether or not there really is a need. And you know, we had our own study. We had the Florida Health Department do a study. I think your committee could reach out to others in the profession, the Dental Association, et cetera, to try and really get a handle on whether or not this is a situation where it would be nice for research purposes, et cetera, to have another dental school, or whether or not we really do have this driving need for it, and that a dental school satisfies the need, or whether the dental schools should be working with the legislature to try and fund some other ways to take care of the underserved. I'm not sure we've answered that question yet, and I would hope that the committee would look at that and bring it to the full board.
Okay. Governor Beard.
Yeah, my sense is if we spend a couple of more months, the bleeding that's going on in this university system, we're not gonna know anymore. The economy isn't getting better. Our resources are being burned up. I just don't see how time's going to help us much in that decision. So I agree with. I'd rather see us take a vote tomorrow.
Governor Temple.
Yeah, there can always be a follow-on at some point in time about collaboration. I mean, we've kind of expressed that as a very strong desire, but that doesn't mean we shouldn't, I think, take a vote tomorrow as a full board on, because we're just spending a lot of time and a lot of energy and a lot of money. So again, I would request that we talk about this again tomorrow.
Can we hear from the universities if they have any thoughts as to whether or not they're
Governor Brogan, and then I'm going to Chancellor Brogan, and I'm going to ask each of the presidents and Joe to have a comment, and we'll try to close it out.
Yeah, real quickly, I just I think we all like clarity, and I think when we hear things like, you know, do we or don't we need more dentists? Is there a need? And believe me, I'm not an expert on this. Just what I've learned in the last 2 years as chancellor, working on this issue with my staff and with the universities. It's a careful line that you walk. I believe Florida has generally enough dentists. We heard UCF today talk about the growth of the state, that not factored into the workforce report from the Department of Health. But at the same time, neither is factored into the Department of Health's workforce study the fact that there is already underway the creation of a private dental school through the Lake Erie College of Medicine down southwest Florida. And as mentioned, there is also the possibility / probability of another private here in Central Florida. So even for those who believe we might not have just generally enough dentists, I think that issue is called or is about to be. Even if you can debate that per capita issue, I think that question is about to be called without the state university being a player in that regard. Whether that's good, bad, right, or wrong, I think mathematically that's the case. But we cannot deny, based on what I've seen in this thing, that there are two issues that we need to wrestle with. Now, who's we? Remember, we're talking here about a public health issue, not a state university issue, first. The issue of underserved Floridians regarding dental and oral health is first and foremost not a state university issue. It is a public health problem. And I think we're sitting here trying to decide how the state university system can unilaterally solve a problem which belongs first and foremost to the state of Florida. We're players, oftentimes, medical education is a good example. When we need things to try to better serve the population, the state university system is here to do that. But in this particular case, I think most reasonable people would agree that if we generally have enough dentists, but the problem isn't the number, the problem is where they're practicing or not practicing, and not practicing not because there aren't good people, but because the Medicaid reimbursement rates are so bad, even with the generous increase from the Florida legislature this past year, we are still, based on the Medicaid reimbursement rates, at a woeful level of reimbursement to the point where it remains almost impossible for a practicing dentist to hang out a shingle, to buy liability insurance, to hire dental hygienists and working staff and operate an office. It is all but impossible, not to mention the incredible complications of trying to just be a Medicaid reimbursement dentist and the complexity that goes along with all of that. So again, I think one of the things when we say we need to get into the conversation, and I've begun those conversations with them, is the Department of Health. Because when we talk about public health problems, you're talking about the state of Florida as defined by the Department of Health. They understand this problem very well. Not only the workforce side of it, but they also understand the complexity of the issue of underserved populations. And they are also very interested in trying to find out how we can better penetrate that problem. But even they agree that starting a new dental school under any circumstances, under any rubric, doesn't guarantee you, because nobody can guarantee it, with respect to all the incredibly smart people throwing themselves at this issue, not only in Florida but across the country, that just adding more dentists, even well-recruited, well-trained dentists, will ultimately get you back to the point where you no longer have underserved populations of poor. So I think when we say come on back with some collaborative effort, I really think some of the first things we need to wrestle to the floor are the basic questions. Should those collaborations include the creation of a new dental school? And if the answer to that one first is we have enough dentists, so let's take on the issue of the underserved population and the issue of minority recruitment and placement of dentists in the state of Florida, and let's do that in partnership with another player, which is the state of Florida, who, from a public health side, this is their issue first and foremost, not to our exclusion, but truly in a priority scale. So I would say if that's where we're headed, is to say, come on back with another take on this thing, some of these basic questions need to be called. You either believe we have enough dentists or you don't. And that's just the way it is. And I don't mean you, I mean anybody. You either believe that people can guarantee you that their unique approach to this will satisfy that problem at the end of the day, or it won't. And at the end of all of that, a collaboration of any kind that doesn't, at the end of the day, take on the things we know we have as a problem, which are underserved pockets of Floridians, and the issue of getting more minority dentists into the trade, we'll be talking about all around this thing a second time with just a different approach. And I don't think that's where any of us want to be.
President Hitt?
It's a little hard for me to respond to all of what I've been hearing. You know, we repeatedly reference a study that shows no need for additional dentists, but assumes that no practicing dentist today will die, and that the state of Florida's population will not grow. If you're happy with that study, that's great. I find that hard to understand.
It comes from the Department of Health.
Well, that doesn't make it right, Frank. If you really assume that no practicing dentist is going to die, you're welcome to that assumption. If you really believe that the state of Florida's population will not grow, you're entitled to that. I just very respectfully disagree. Second, it's asserted that we're spending a lot of money that we're not spending. Our whole proposal is based on no state appropriation. So I don't know quite how to respond.
President Ammons?
I think one of the consistent findings of all of these studies is that we have a tremendous problem in rural and underserved Florida when it comes to oral health care. The proposal that FAMU has put forward focuses like a laser beam on that issue. It is a model that puts our faculty and students where they're needed. It is a cost-effective model. It is built on collaboration. There are collaborations that we have been discussing with universities, with community and federally qualified health clinics, with private corporations, with local governments, and we need to have the opportunity to see how we can conclude these conversations by bringing to the state of Florida a cost-effective, proven method of putting healthcare services through our faculty and staff in places where they're needed. Even the study that was concluded by the Senate that you just got yesterday or the day before yesterday concludes that in rural and underserved Florida, there is a shortage of dentists. And every report that we have seen on workforce issues in oral health care concludes that we have a shortage of dentists in these areas. And the proposal that we have put forward clearly states that that is the focus of our College of Dental Medicine. And so we need the time to conclude these conversations with our collaborators.
Provost Glover?
This obviously is a difficult conversation. I don't envy you your position. I think the University of Florida obviously is in service to the students of this state and in service to the state itself by providing services such as dental services throughout the state in association with its educational program. I think what you've heard today are three proposals. They all have their differences and similarities. You will judge what are the advantages and disadvantages, and you will make probably a decision which integrates more than just academic factors. As the Chancellor was explaining a few minutes ago, there are obviously lots of other considerations that you need to integrate. I think at this point that all that I can say is that as a well-established dental school in the state, we are open to continued conversation with other universities. I know that Dean Dolan has already made herself extensively available to other schools in these discussions. She is an expert on dental health care policy in the state and the nation. And so I will just extend an invitation to all who would like to talk to us, either for additional information or to discuss partnership opportunities, to say that we continue to be open to those discussions.
Any other comments or questions from any board members? Okay. We will adjourn part A, take up B tomorrow. Think about what you've heard today. I would like to have a discussion tomorrow, continuation of this, and then let's bring the issue to closure tomorrow. All right? If that, meeting adjourned.
Very good. Well, so yeah, you're temporarily adjourning because you're scheduled to finish up tomorrow.
Yes.
Perfect. With that, I want to say thank you very much, and I appreciate the dedication that all of the board members have had. It's now 6:30, and our great host for this evening is Dr. Rosenberg, and we want to thank you so much for the hospitality we've been shown so far here at FIU. Can you give us some direction about the rest of our plans for the evening, please?
Madam Chair, there is a reception at the Patricia and Philip Frost Art Museum. We're prepared to lead you and all remaining guests to the museum. They are waiting. I know that there are plans for some caucuses, dinners among certain groups, so I would leave it up to you to determine if you would like to have the reception. We are ready to go. If you want to have the other, yeah.
No, we are on our way to the. I guess the question is, do we walk there?
Yes, yes. We'll walk out the door to the left, the double left, and then straight through the Graham Center, and we'll have people leading us.
Thank you very much.
We're happy that you're going to go.
You over at the museum.
Yes.
Thank you very much.
Double left.